Joe, welcome to our end of legislative session special for 2026. It just happens to be St. Patty's Day, so thanks very much for wearing your green. I got mine on as well. Had to put that on so I don't get pinched, by the missus later on today. But we're looking forward to this week's podcast as we recover, actually not recover, as we cover what happened in Tallahassee during our show. Of course, this is the podcast, three healthcare headlines you need to know from Tallahassee. My name is Fraser Cobbe. I'm the director of a number of the county medical societies and specialty societies in the state of Florida. And look forward to giving you guys an update of how legislative session wrapped up last week. And Joe, look forward to today's program with you.
Yep. We'll recover tomorrow after. So you do that after St. Patrick's Day. But I'm glad you mentioned pinching. It's kind of like all the kids. My little 3-year-old, my little 1-year-old, sending them off to daycare today. They didn't really understand like why they had to wear green. They're like, my daughter especially was like, I always wear pink. Like why would I ever want to wear anything but pink? But hopefully they don't get pinched at school today. So. Just to let everyone know, my name is Joe Daraskevich. I do work alongside Fraser Cobb at several medical associations and societies across the state of Florida. And each week during the session, we get together and highlight a handful of headlines as they relate to the healthcare industry. And it's always a lot of fun. And it's always kind of bittersweet when we get to the end of session, but it's not always the end. So we might have more to talk about in the months to come. But for today, we do have a lot to talk about. So you ready to dive right in and talk, or any more opening thoughts, Fraser?
I thought your kids are going to owe me down the road, and hopefully I can remind them of this frequently. But Marissa was going to send them to school in regular clothes today because she thought St. Patty's Day is tomorrow. So they owe me one, and I'll be sure to collect down the road.
Yeah. They're fighting. They would be fighting off the pinches all day. I wonder. I wonder if that is a thing. I mean, I hope it is. I hope it still is a thing. But different generations. I don't know if pinching is still okay in the schoolhouse as it was back when we were growing up. So anyway, happy St. Patrick's Day to everyone. I hope everybody gets to enjoy it a little bit. It is also coinciding with spring breaks for some people. So I'm sure some of the doctors are out there gallivanting around and enjoying themselves for St. Patrick's Day. So we'll now shift gears and focus on some important headlines from over in Tallahassee. And without further ado, let's jump right in. Number one today, Fraser. No morning sun lasts all day. 2026 legislative session ends with a little drama and not much action. Okay, good headline to start us off.
Yeah, I did use some famous Irish little sayings there for each of the headlines this week. So hopefully you guys enjoy those as we go through them. But yes, we did not bury the lead there. Legislative session is now officially over. It did sine die on Friday. And as you remember last week, we talked about the difference between just extending session or if they'll actually close it and leave home. They decided to just close it, which means all those substantive bills that were on the table that were being considered are no more. So they do not exist other than in people's minds and hearts. And we'll see how many of them get filed again next year. The legislature actually passed only 234 bills this year. So they did not get very much work done up in Tallahassee. And we'll talk a little bit about more of that today as far as what healthcare bills did pass and some of those that came up a bit short. But they are officially gone. As we teased last week, there are multiple special sessions that have been announced. So they're going to do one on the budget. They're going to do one on property taxes. So their work is not through up in Tallahassee. It's just come to an end for now.
That is for sure. And since it is St. Patty's Day, if there's a bill that you were opposed to that kind of died before the end, raise a pint to that bill and celebrate that it didn't make it to the finish line. And if there's a bill that's near and dear to your heart that didn't make it all the way through, then also raise a pint to that one. And then also remember that it's the long game. So this is some things we talk about every single year, and it's a very incremental system where you can hopefully bring it back next year, right, Fraser?
Exactly.
All right, on to number two. It is not a fish until it is on the bank. Legislators catch a few fish during session, but not many whoppers. I like that one too. I like that headline, Fraser.
Thanks very much for that one. Yeah, we had tracked many healthcare bills over all these podcasts the last couple of months as we've been following all the activity up in Tallahassee. But only a few healthcare bills made it through. So obviously, only 234 bills total passed. So there was quite a few dealing with healthcare, but not that many that we were paying special attention to. I did want to mention a few though. The office surgery standards bill did pass. We talked a little bit about that on one of our shows. It didn't do much, so there's no major lingering impact we can see, other than one subtle change. Currently in the regulations, you can have 4 office suites going if you're a medical practice. This is in office surgery we're talking about. You can have 4 suites going. This will enable you to have 6 going at the same time, but it is going to increase the surgical standards as far as the infrastructure and the layout and everything, the building code related to that. So the devil's going to be in the details on the building code. The bill just authorizes the state fire marshal to come up with a plan and new standards for that. So that's office surgery standards is one bill. Claims against the government. We talked about that bill, I believe, last week, which is increasing the financial amount for sovereign immunity in the state. That bill did make it all the way through the legislatures off to the governor. And that would increase. Currently, it's 200,000 is the limit for a single case in a claim against any government entity. It's going to raise it to 350,000. So it was a bit of a compromise there. It had been looming for a number of years to get that increase. So it looks like that recommendation is off to the governor. Also, the sickle cell education bill we talked about probably way back in like week 1 or 2. We did some work to fix that, our concerns with that bill at the start of session, so we haven't followed it too much. But it has passed both chambers. It's been sent to the governor, and it does mandate some additional education for all physicians in the state on sickle cell management, but it adds the education into the already mandated prescription drug. Your prescription drug, what is that called? Opioid controlled substances prescribing mandate that's currently on the books already. So again, it's not a new mandate for additional CME education. It's just we're expanding what's included in that controlled substances program to include some sickle cell as well. On the flip side, the one bill that did pass this year that we had some concerns with is the naturopathy bill. So that got some really late momentum. It had like passed one committee over on the House side, and then all of a sudden it got legs and ran as sprinted all the way through both chambers, and now it's off to the governor for his signature. We are talking with the governor's office a little bit about some of our concerns around that bill. It's just broadly defined. If you'll recall, current statutes do not define the practice of naturopathy, so there hasn't been a licensure process for naturopaths. So some of the legislators that support this bill felt there should be a role of the government to at least ensure some standards of what people are doing out there under the guise of naturopathy. The language is kind of broad. It does let them diagnose and treat medical conditions. There are some limitations on how they do that, though, as far as they can't prescribe medicines. So we'll be watching that. We'll see how it's implemented. It does create the Board of Naturopathic Medicine in the state. So again, we do have some concerns about it. That is the one bad bill that passed this year that we'll just have to monitor how it's implemented down the road.
Well, and
But
that
that's about
yeah, I was just going to jump in right there and let you know that, or let everybody know that that's a good reminder that the legislators are coming back to their districts now, and obviously, session is over and everything like that. But if you find yourself at a fundraiser or at something where one of these state reps or state senators are there and they might have a question about, hey, why was that bill, something you were opposed to? Let them know. In their own backyard, let the lawmakers know why we're opposed to certain things and what the ramifications can be. If legislation is not exactly, how they need to, how it needs to be going forward. But I just want to jump in and didn't mean to interrupt you there, Fraser, but I just want to let everyone know, like, now the legislators are coming back into their own backyards, and this is a good chance to kind of make those relationships stronger, when they're back home.
Yeah, definitely. There'll be a lot said about all these bills back home. All of them now have to go to the governor for his signature. That's not always a slam dunk. Sometimes, obviously, he uses his power to veto some of these bills. So we'll see how that transpires over the coming weeks. But yeah, our big thing with the naturopathy bill is just making sure, well, we recognize the state has a role in regulating what's going on. We want to make sure patients aren't under any um, misunderstanding as far as the medical training and background of these naturopaths as they're rendering treatment to them. So I think a lot can be done from an education standpoint to make sure the public is aware if they are seeing one of these physicians, no, naturopathic physicians, they know exactly the training education that they've had.
And that's a good point too, is even if you're just dipping your toe in the advocacy pool, just talking about your own training that, to become an MD or a DO, it's not easy. It's a long process. A lot of people can't make it through that full process. So if it's as simple as, if you just find yourself face to face with one of these legislators, just kind of explain your own path, explain how you became, a full-fledged physician, and just letting them know like that compared to other people who are treating patients, it's a big difference, obviously. So even if you're not, versed in every little bit of the bill, just talk about your own experience, and that goes a long way when you're talking to someone who most likely is not a physician themselves. Most likely, they're not as familiar with the medical world as obviously all the doctors are in the state of Florida. So just go ahead. Yeah, it's a good way to get started, right, Fraser?
All these scope battles, we always talk about there shouldn't be different standards of care. We should have the highest standards of medical care in the state of Florida. So whether you're trained by a different, through a different path, the patient at the end expects the same standard of care, whether they're getting that from a podiatrist, an advanced registered nurse practitioner, a physician. There shouldn't be different standards for different people. So the more we can educate, the more we can promote high standards in the state. That's what we do, and that's where we usually fall down on our advocacy efforts.
And we advocate for the patients. It's obviously we're trying to get physician friendly legislation through over there in Tallahassee. But when we talk to the lawmakers, at in Tallahassee, back home in get-togethers in their home bases, at the end of the day, that's what we're trying to do is make sure that the patients are taken care of and make sure that the patients have the best health care possible. And we just that's how you kind of spread the word. So. Any last thoughts on that headline, Fraser?
Hooray for number three.
All right, number three. Here we go. Many a ship is lost within sight of the harbor. Bills that failed are the true story of the 2026 legislative session. The theme continues, Fraser. I like that.
Yes, good reading on that headline, Joe. Yeah, there's a lot of bills that we've been talking about that just failed to make it. And we've been teasing these last several weeks, a bunch of them that we had significant concerns with, both from a patient safety standpoint with the scope of practice bills, as well as some of the tort issues that we're moving. So the wrongful death bill passed the House very early in session. It never got a hearing in the Senate. The Senate has now left town without taking any action on that bill. So the wrongful death expansion is dead for the year. The Speaker of the House, of course, had a number of bills that he was championing around scope of practice expansions for APRNs, whether that is the nurse anesthetists or the psychiatric nurses, as well as his big bill, the big frontier, healthcare frontiers bill that enabled all APRNs to practice autonomous practice for any specialty. That bill also died as well. So again, the story that's going to be told for decades to come on this year's session is those bills that did not make it all the way through the process. They will start over again next session, but you'll have a new Speaker of the House, you'll have a new Senate President. So we'll see what the tone is in Tallahassee and if some of these bills that have been discussed for a while, scope of practice, wrongful death, those issues are not going anywhere. We'll just be addressing them with a new leadership and through potentially different lenses moving forward.
Yeah, and I mean, I don't want to say it's fun, but that's kind of how it works, where it's these same topics that kind of come up year after year, and the same physicians who go over there and kind of advocate, they remember the talking points, they remember all the different things that they spoke about the year before. But then there's new people on the other side of the desk. There's new people kind of running the chambers, and there's going to be a lot of change, with an election year. So once you know who's elected and which people are in place, it's good to kind of make those connections, and then we'll do it all again in 2027 when the session comes back around. But I don't know. I know it's three healthcare headlines, Fraser, but I think the people want a little more this week. Do you think we should give them one more headline?
No, I mean they've been following us week after week. We can't just leave them for this off season with
Yeah.
just three headlines, right? That'd be wrong.
Right, Fraser. So we got something in store. Don't turn off your computer or your phone just yet. We have a fourth headline today. By popular demand, we're gonna give it one more, and I'll jump right into it, Fraser. May today be better than yesterday, but not as good as tomorrow. Could legislative leaders add healthcare bills to a special session? That's a great
Nice.
question. Jump in, Fraser.
Yeah, and truth be told, I needed that fourth proverb just because it was my favorite out of all of them. Just
It's
makes
a
you
good
want to
one.
pick up a Guinness and cheer today and look forward to tomorrow. But yeah, there's been some rumors already that the AI Bill of Rights that included some legislation that we liked around making sure that humans are involved in a review of insurance claims before they're denied. That bill, as well as the medical freedom bill, which we have some concerns with, that both of those may be added to the special session on the budget. So that takes all of the leaders to agree to include those issues on the special session, since those bills are not going through a normal process as they would during session. So to officially add them in, all parties would have to agree to that. So we'll be watching that medical freedom bill. The governor spoke in support of that and wanting to continue to have that discussion. So we'll be monitoring that moving forward. Again, many of our physicians have concerns with continuing to expand the reasons why or the options for patients, or sorry, parents to opt out of vaccines for their kids, and what that does for community safety in the schools. So we'll be monitoring those bills. Again, we'll let people know. One thing about when bills get added to special session, usually agreements have been made in advance if they are even put on the docket. That doesn't always happen, but that's kind of a tell for us over the coming weeks. If there starts to be more and more clamor to adding those bills, it probably means there's momentum behind the scenes. Nobody wants to add a bill to special session to just get in a big kerfuffle again about it. So again, that might be the tell that we'll be paying attention to in the coming weeks.
That's a good point. And I know, especially the pediatricians around my neck of the woods, around the whole state, everyone's been kind of watching that pretty closely. So we will also watch very closely, and that's a good tip that they're not just going to bring something back to bring it back and then kind of have everybody get all up in arms about it again. So we'll let everyone know. Well, whether it's on social media, whether it's another special, podcast recording that you and me do, we'll figure it out and we'll let everybody know before long. But that's a good wrap on the session, and then a little look forward that there might be more to come, but just stay tuned. That's where we are. So, any last thoughts on this session? Any last thoughts in general? Any last thoughts, Fraser?
Yep, it is an election year. So legislators are now back home. So they'll be knocking on doors, looking for support, both from their constituents in the form of voting, as well as contributions from supporters and PACs and other organizations. But this is the time to educate. The time to educate legislators is when they are back home in the off season, when they're running for reelection or their first time running for office in Tallahassee. It's hard to get to bend their ear when they're in Tallahassee because there's so much going on. So while we take a breath, we look back at what's just transpired, um, and rest on that a little bit. Our work continues to educate these folks and prepare for next year's session.
Yeah, and I know some people. One thing I also want to say is there's these legislators have a lot on their plates, so it's sometimes some people can have opinions on one bill that a senator was in favor of or a representative, it's like, hey, how come they changed their mind on one thing or another? But it is kind of the big picture. We need to talk to just about everybody. We need to make sure that we're having relationships with a lot of different people because you want them to be in your corner as much as you can get them in your corner. So be friendly, be not try not to make enemies back home with anybody, and ask them questions. Hey, what was your thought on this bill? What was why'd you flip one way or another, or why'd you tell me this before session and then vote another way when it got there? And just be cordial about it. That's all I will tell people is you catch more flies flies with honey than vinegar, and don't go at them, back home and just kind of, fist clenched and just kind of getting out in their faces about one particular bill that they voted the way that you didn't want them to vote, because you need them to be your friend and your ally going forward more often than not. So that's just my little tip of the day. You agree with that, Fraser, or what are your thoughts on that?
And you got your own proverb in there too with honey and vinegar. I like it.
Yeah, yeah. Well, so as we do each week, should I give them a musical selection? You ready for that?
Should, yeah. And also, as you're doing that, just continue to tell our audience we are going to release that poll again this week. We are looking at our summer concert series with Jason Bird getting out there around the state and interacting with some of our members. So that poll will be released again with this week's episode. So we hope you guys will actually take just a moment and click on the link and give us your thoughts. But
Yeah, and
other
that's
than that,
Jason Bird with a Y. Jason Bird with a Y, right? That's the key there. But
Bird with a Y.
yeah, I'll just chime in too that Marissa and I, anybody knows Marissa Daraskevich, she's works alongside us too at several of these societies, and we've been doing a thing where we pick the kids up from daycare and we'll listen to that Jason Bird song on the way home, and the whole family's dancing and getting enthused about it. So even if you've never heard of them before, give them a listen, and that's the whole theme, is we're gonna have kind of a musical, tour leading up to the FMA this summer. So look for more on that. Look for the poll on whether you would attend something like that. But now we're looking into venues and looking into dates and everything. So it's all kind of coming together, and we'll have a little fun time leading up to the FMA. But I want to give another my musical pick today, Fraser, is a band that I didn't want to leave on the sidelines now that session is over. This is a an up and coming band. They're the father of one of the guys is in another band, and they may be bankrolled by him, but I'm not sure. The band is Eggy, Egggy, and the song is Buying Time. So, in my time, a lot of this, the legislative session, we're buying time. We're trying to, push things on to the next thing. And it just kind of made, I wanted to get Eggy in there, and I thought that that was a good song that everybody would enjoy. So that's my musical selection from today, Buying Time by Eggy.
Nice. A good way to wrap up this year's session and to close. It's been a lot of fun, Joe, getting together with you each week and sharing what's going on in Tallahassee and sharing some musical tips along the way, too. So it's been a lot of
Yep.
fun. I look forward to keeping folks updated in the off season as well.
Yep. So for now, everybody enjoy spring break, enjoy the warmer weather that's on its way, and feel free to reach out if you have any questions. We're always happy, whether it's in person, whether it's in an email, whether it's a comment. So let us know what's on your minds, even after session, and we'll be there for you if you need us to fill in some blanks for you. But again, Fraser, it's been a great session. It's been great meeting with you. But for now, we'll say our goodbyes.